Our case today, a 4-year-old child presented with fever, cough, and shortness of breath. History reveals that he has recurrent attacks with the same complaints, diagnosed and treated as pneumonia. Also, he had repeated diarrhea. Perinatal history revealed that there was a problem in his screening, but his parents didn't respond and they had some issues. General examination showed an ill thin child, his weight on the second centile, and his height on the third centile. Chest examination showed tachypnea and musical sound. So what is the most likely diagnosis? This is a case of cystic fibrosis, current attacks of chest symptoms and repeated diarrhea, and problem in his screening test, weight on the second centile. All of these are suggestive of cystic fibrosis. How to confirm the diagnosis? Sweet chloride test. If more than 60, it is positive. If less than 40, it is negative. Now we need to discuss the pathogenesis and the clinical manifestations. Cystic fibrosis is caused by mutation in the cystic fibrosis transmembrane conductance regulator. This leads to sick viscid secretions, mainly in the lungs and GIT and the reproductive tract. Lung manifestations usually respiratory symptoms like pneumonia, also chronic productive cough and bronchiectasis. Nasal symptoms can be a sign of sinusitis or nasal polyposis. Gastrointestinal and liver and pancreas. Pancreatic insufficiency can be presented by diarrhea, distal intestinal obstruction syndrome, constipation, and abdominal pain and fecal masses. Meconium ileus in the neonatal period, constipation and intestinal obstruction. Cystic fibrosis-related diabetes presented with polyuria, polydipsia, and high glucose. Vitamin deficiencies, especially A, D, E, K. Recurrent pancreatitis presented by abdominal pain. Dermatitis resembling acrodermatitis enteropathica with fatty acid and zinc deficiency. Rectal prolapse and volvulus in the fetal life. Also, liver can be affected and biliary cirrhosis with portal hypertension can occur, and this presented with hematemesis and bleeding per rectum, in addition to edema. Regarding the reproductive tract, bilateral absence of vas deferens can occur with patients with cystic fibrosis. Male infertility, reduced female fertility. Other manifestations like hypochloremic, hyponatremic alkalosis, bone osteoporosis, CNS, pseudotumor cerebri. How to confirm cystic fibrosis? First, newborn screening. Some cases of cystic fibrosis will be missed by newborn screening. So, it is important to consider cystic fibrosis in individuals with suggestive symptoms, even in individuals who have negative results of the newborn screening. Sweet chloride test. Sweet chloride more than or equal to 60 millimole per liter is abnormal and is diagnostic. Sweet chloride less than or equal to 29 millimole per liter is normal. If 30 to 59 millimole per liter is intermediate. These patients should have repeated tests and or CFTR sequencing, genetic testing. Finally, DNA analysis or genetic testing for intermediate or positive sweet chloride results. Also positive should have genetic testing. Sometimes we need to do DNA analysis if a sweet chloride test normal and there is a strong clinical suspicion of cystic fibrosis. Thank you for watching.